Welcome to the YMyHealth podcast. I'm Melissa Schenkman, your co-host for today, and we're going to be starting one in a series of podcast episodes on a topic that I think is so important to our generation, but also just so ingrained in what YMyHealth is all about. Which YMyHealth got started because of this misconception of how millennials are all young and invincible. And while may look young and invincible, inside we aren't always invincible, as many of us find out. And so today we're going to be talking about invisible illness, specifically with physical symptoms. A lot of us look great and healthy and young, like I said, on the outside, but are dealing with physical symptoms that people don't realize. And they don't realize all the things that we have to do every day to be able to work and go out and socialize that you just don't see. And physical symptoms, are more, a lot of times that we're going to talk about, more kind of verbally expressed at times, as opposed to when it's mental health symptoms, which are also invisible as well. So we're going to focus more on the physical. So we are so fortunate today to have Dr. Alexandria Yarbrough with us. She's a member of the YMyHealth team. We've been so fortunate to get to know her, and she is a pharmacist, specifically a pharmacist in charge at Sam's Club in South Carolina, and she is also a POTS patient, and someone who, from the outside, like a lot of millennials, like we're talking about, looks young and healthy, and has had to deal with so many different things in relation to POTS. And so today we're going to talk with her about what invisible illness looks like in the space of POTS. And POTS, just to remind everyone, stands for postural orthostatic tachycardia syndrome. And we'll talk a little bit about that in the beginning as well. But welcome, uh, Alexandria.
Thank you so much for having me. I'm excited to be here.
I'm excited to have you here, and Julie is very excited you're joining us as well. Just to kind of start, as a fellow millennial, what are some of the most common phrases you've had people say to you about your health kind of throughout the time of when you first started experiencing symptoms of POTS until you were officially diagnosed and treating it?
I think it was a lot of you look perfectly fine or you look healthy. That's a big one that I would get a lot, or you're too young for this, or you're not work, or you're still doing what you have to do, so maybe you aren't as sick. Those weren't necessarily directly said, but a lot of times they were implied. Just because if you were sick enough, you almost had to prove it. And that's just kind of a really kind of strange concept that we don't see in any other situation. If someone has mobility issues and they're in a wheelchair, you don't ask them to prove that they can't walk or they're having trouble, or if someone has some kind of other illness that is very apparent. But if it's something that someone can't see, it's like as if they don't believe it.
Absolutely. No, that's an excellent point and excellent way to illustrate it as well. And even though you were, going to work and going out with friends and looking healthy on appearance, what have been some of the symptoms that you've experienced internally that people had no clue that you were experiencing?
So physically, I would have like a increased heart rate. And until I became pretty well managed, which is what I consider myself now, before I kind of knew when it would flare up or what was going on, it could be any time for any reason that I wasn't aware of. So I would also have temperature issues where I would get extremely overheated or sensitive to cold, or sometimes I would just get extremely nauseous. And it's just really hard to plan your life around things like that. You then kind of have like mental kind of symptoms too. You become anxious, just because do I need to tell someone about this? Do I need to tell everyone what's going on? So that's difficult. So you're dealing with both the physical things, increased heart rate, temperature issues, nausea, and then also too the anxiety and how is that, intertwined with it. So there's just kind of a lot going on, and you just don't know really how to deal with it.
No, understandably so. And I would imagine, like, for so many different conditions, POTS, I would imagine falls into this as well, is the unpredictability
Mhm.
of what you're dealing with something that is not, you know, apparent to the eye. Um, that nausea is unpredictable. You don't know when it's gonna happen. Are you gonna be at work? Are you gonna be out with friends? So I would imagine that that unpredictability kind of plays into the anxiety as well.
It does, and a lot of times too, then it becomes, an issue of preparing. Do I need to take
Mhm.
these medicines? Do I need to take a jacket? Do I not need to? It's almost like I'm a mom with a diaper bag with all these different things, so I'm preparing for so many things that could happen, and they absolutely could, or nothing could happen at all, and it's just kind of a really tumultuous way to live your life.
No, absolutely. It certainly sounds like, and it certainly is, and from the other YMyHealth contributors who we've had the honor of interviewing over time, they've said that to us as well. Is this preparation, having to take certain things with you just in case
Mhm.
um, of a flare up, and with all different conditions, and but especially also with POTS. And so at work, you're the pharmacist in charge at Sam's Club in South Carolina, as I was mentioning. And if any of our listeners have been to a pharmacy, which I'm sure you all have, in the past 5 years since the beginning of the pandemic, you know, it's very noticeable that pharmacists are working nonstop for hours at a time. You're on your feet, whether it's you're filling medications, you're consulting, patients are coming in with different things and they want to talk to you. For you, Alexandria, while your customers are there watching you do this work nonstop, what they don't see, with you, is that you had to do all these things perhaps that morning to be able to come to work, or the evening before to be able to serve them. And so if you could talk a little bit about how your daily routine, living with POTS and trying to prevent flares, what that entails so that you can do the wonderful work that you do.
So it's a lot. It's something like I still have to prep a lot for. I have to pack certain lunches. I used to could just grab lunch at work. It would be no big deal, but now I know that I need to rest during lunch if I'm able to get my full 30 minutes. And so I have to prepare that way. I'm also not able to take some of my ADHD medication. So now I have to supplement with a certain type of energy drink that allows me a certain amount of caffeine to kind of help with my fatigue. So I have to make sure I pack those every day. And then also too, I do have an accommodation at work, which is great. I have a stool, but it's not very helpful because I can maybe sit for just a few minutes to verify some prescriptions, but then I have to get up to go counsel someone or to help at the register or to give an immunization. And so, as helpful as it is, it's almost kind of not because I'm going up, down instead of just trying to be, stationary. So it's just a kind of different normal or a new normal I've had to kind of, you know, become accustomed to.
Yeah, and the new normal, I think that concept, I think for so many in our generation is one of the most challenging parts of all of this that you speak to. And because we're used to things being easier prior to symptoms starting and flare-ups, before diagnosis. I'd say the majority, except for those who maybe started having symptoms and things in their teenage years, those once they've moved into their mid-20s and in the working world and have not had to deal with any type of health challenge or any symptoms and things to prepare for on a daily basis, getting used to what that new normal looks like and figuring out the best new normal as well, can be a big challenge. And speaking of that, you were mentioning about the stool. I think there's so many, which you're pointing out. You can face some major challenges in the workplace professionally, just because your job is very demanding as a pharmacist, and there are so many other jobs that millennials do that are demanding in their own ways as well, physically and mentally.
Mhm.
That take that energy, which is a big piece of chronic illness, and with the energy levels. What was it like kind of navigating even getting the stool as an accommodation? Because I'm sure that your doctors maybe recommended certain accommodations, but then you have to see in reality with your workplace, what will they be able to offer? And so I know that that is a big piece for a lot of millennials, is how to navigate between the two, the healthcare recommendation and then the actual workplace.
So I am thankful that my company was able to approve my accommodation, but with any type of accommodation, it still takes time and effort. You have to fill out the appropriate paperwork, you have to get your doctors involved, and that's just only part of what they do on their day to day. So, it takes a little bit of time to get in contact with them, and then also you have to reassess every so often. And then I am thankful for the stool, but there's really no other accommodation that's available. I'm not able to work from home. I work in a retail pharmacy, and I'm not able to do that unless I'm in that space. So, that's kind of one of the downsides of it is there isn't anything that can be done. I would have to dream it up, I guess. Uh, but yeah, I am thankful, but still it is a process and I don't really have a backup if they would have said no, which,
Yeah.
because it is a job that I agreed to do that has certain physical requirements. So that is something to consider.
Oh, absolutely. No, I appreciate you telling us that. And I wish, as we have talked before, that they would do more, that and because there are just so many people like yourself that you and I both know who could really use multiple accommodations to try and make the workplace experience better. And thankfully, you're doing very well with these days with what you have, but you're still doing all these different things. And I think um, that's the thing that people don't realize is that even when you are doing well, and that is the goal 100%, to not have flare-ups, to keep your symptoms in check and be able to have the best quality of life you can, not only in the workplace but very importantly outside the workplace as well with family and friends. What are some of the things that you have to keep up with on a regular basis to prevent having a POTS flare up?
So I just have to kind of know my limitations, which is really hard to do because when I'm feeling well, I want to be able to do it all. I feel like my old self. But that's pretty hard. So for instance, I used to only do grocery delivery, but now I'm able to actually go and get groceries, but that's still not every time. And so I know if I do that, then I don't need to walk my dogs that day. And so just kind of putting those limitations on yourself is really hard, but it's something I have to do because if not, I don't want to risk having a flare up because then I won't be able to do anything for the rest of the day or even into the next one.
Okay.
So one of the things that I don't think a lot of people realize is the doctor's visits that I still have to keep up with, even though I am managed pretty well. So I have to go to the sleep doctor every 6 months. I have to get shipped this special medication that I have to mix up and take every night. So that is related to my POTS. I also have my cardiologist visits that I have to do in order to be prescribed my medication that I take every day. So even though I'm on a path right now where I am doing well, it could change tomorrow and I could not doing as well, and I still have to keep up with these things in addition to, like, a full-time job and my kinda day-to-day management.
Yeah. No, it's a lot, and I appreciate you sharing that with us. It helps people to have a better understanding of what may look invisible is not so invisible, and so limited in what you have to do. There's a lot, and then in terms of social life, which is such a big concern, right, to all of us. I know you have an active social life. You have a lot of lovely friends, and I know you recently had your bachelorette party. How have you kind of navigated social life with POTS symptoms and trying to prevent flare-ups?
So the biggest thing is I have to communicate with everyone. If I am doing something, I have a certain bedtime that I have to adhere to. Sometimes there might be a little bit of flexibility, but no more than like 45 minutes to an hour, just because I know if I don't get that rest and if I'm not able to take my medication a certain amount of time, I'm not going to be able to function at all the next day. And that could just result in fatigue or that could result in increased heart rate. And so it's just not something I can risk. So anytime I go out, um, people are pretty much aware that I'm only able to have like one adult beverage if I want to, which made for a very chill bachelorette. uh, but also too that I do have a certain bedtime. So I am lucky that I have a great core group of friends, but it is something that if I didn't have that or if I was in a new city trying to meet people, I wouldn't necessarily want to disclose, but it's necessary just because this is a part of my life now. And so I don't get to go to those late night movie premieres. I don't get to stay up too late to watch different things on TV or go to a certain event. So it kind of stinks, but my health isn't worth the risk.
No, absolutely it is not, and that's really helpful for a lot of people to hear because that time, that rest, what a difference it makes in being able to adhere to it, and it's wonderful that you have such a wonderful group of friends who are understanding and where you all can have fun, but you can also take care of your health at the same time, which is ideal. So as you look back now, well, actually remind me, how long have you've known for over a year and a half? I feel like
With that, so it's been about the all of it's been, like, 3 to 4 years now.
oh, since the beginning of the symptoms. Okay.
Mhm.
Okay. So let me so over the past 3 to 4 years as you've gone from initially having symptoms which you didn't even realize, like most people don't, were symptoms of POTS, to getting a diagnosis, to getting proper treatment and finding the right treatment for you to maintain, your symptoms and to prevent flare-ups. Kind of as you look back through this time, how do you think people who have friends or family members or coworkers who they know in their life are living with an invisible illness? How can they be most helpful to them?
I think the biggest thing that they can do is just ask us what we need. There's been a lot of issues, I think, across the board with anyone with an invisible illness of toxic positivity. Like, you can do it, just keep pushing through, you try harder, you're doing great, and those things can be helpful at times, but when, we're having a rough day and we're needing to rest and we're trying to focus on rest is productive, like, just keep going and push through isn't very helpful. But, we might need a Netflix recommendation, or we might need you to help us plan a dinner that's easy, that's a couple ingredients, but we don't know. You don't need to add to our mental load, just ask us what we need and be direct, and, I mean, I know I'm happy to tell you, or, that might be something where some people do struggle, but just don't try to guess what we need because it might actually be harmful.
Oh, I appreciate you saying that, and I think that's makes a lot of people think about what they can do and what they can say also that would be most helpful, because people do wanna be positive, but there's also the reality, right, as you're saying, and so, it sounds like actually asking is a much better way to go. So I really appreciate you sharing that with us.
Of course, I realize everyone has great intentions, but just if they're not someone who's living with this day to day, sometimes it can just be really challenging for us to hear.
Oh, absolutely. Absolutely. Well, thank you so much for taking time out of your very busy schedule to join us and to kick off this series. I think there are so many millennials and people in Gen X and older who this will be so valuable for because I think this is one of the things, not only POTS being something that is diagnosed these days in more and more millennials, but really this invisible illness and chronic conditions that so many of us who look healthy and young and invincible are dealing with on the inside, and we want people to know more about that, and have more understanding. So thank you so much.
Oh, thank you so much for having me.
You're so welcome.